Hello, I'm Dr. Michael Hansen, and am coming to you today to talk about the tongue. The tongue really is an amazing muscle that affects and shapes everything that we do in our clinic, and so wanted to make this a video today for my specific patients that are in treatment. To help them have an understanding of what the tongue does and its importance in what we do. Of course, you know, if you're seeing this video and are not my patient, it's still good information, but it is just information. Don't let it be construed as medical advice. That being said, I'm excited to talk about the tongue today because we've found that its function and resting position really plays a critical role in the growth and development of our jaws, and that alone has many consequences that affect us. We know that the tongue is really the scaffold for our upper jaw. A strong, well-developed tongue that has good range of motion is going to help drive the outward and forward growth of that upper jaw and create the space that we need for our teeth to erupt properly, for our airways to develop correctly. And it's, again, very much driven by the muscle that we know as the tongue. Now, when the tongue is functioning correctly, it should be sitting all the way sealed up in the palate or the roof of the mouth, like we see here in figure A. That should be its resting position or its parking spot when it's not being used. Now, the tongue doesn't always function that way for many of us. When it does not function correctly, it sits with a low tongue posture. There are several reasons that this could happen. One of which could be nasal obstruction. We just are unable to breathe through our nose well and are forced to breathe through our mouth. Another could be Ankyloglossia, also known as a tongue tie. But whatever the reason, there are consequences when that tongue does not function properly the way it should. When it is functioning properly, the tongue is placing an outward force on that upper jaw as it's growing. That helps drive and direct the growth of that upper jaw to be wide and forward, nice and open for all our teeth to come in properly and things to position and function correctly. When, on the other hand, that tongue is not allowed to sit up in the palate, for whatever reason, what we see is that the lip and cheek muscles will then take over and have a constricting or restricting effect on the growth of that upper jaw, resulting in a smaller than normal upper jaw. Conversely, the tongue, when it does sit low, will put that outward pressure on the lower jaw quite often. And so we see a normal-sized or even oversized lower jaw. Ultimately, this ends up giving us a smaller than normal upper jaw, larger than normal lower jaw, and trying to get this discrepancy to match up and fit together can prove to be quite problematic and causing a whole cascade of problems that we'll talk about in other videos. But for now, know that the normal way to function is with the tongue resting in the palate. I'd mentioned a minute ago just that one of the reasons that the tongue sometimes cannot fit all the way up in the palate is because it is physically tied down by a special connective tissue called fascia in a specific area outlined here on this image, and it physically tethers the tongue to the floor of the mouth too tightly to allow it to normal function to sit up in the palate without strain or some other kind of compensation. And this connective tissue called fascia we find all throughout our bodies. Fascia is a thin casing of connective tissue that surrounds and holds every organ, blood vessel, bone, nerve fiber, and muscle in place. This image shows the fascia connection of muscle to bone. So bone sitting down here, muscle connected to it by that fascia connection. And then it also shows the muscle fascial connections to each other. And if you think that this looks kind of like a steak, you'd be right. If you know, the white connections and skin-like covering that you can find on a steak is the fascia of that muscle. That fascia is found everywhere. However, it can be concentrated and more fibrous in areas needing extra strength and support, kind of like the fingers shown here. One of the areas this connection that it's connected very securely like this is often under the tongue. Sometimes the fascial connection can be excessive, and if it impairs function in any way, it's known as Ankyloglossia or a tongue tie. Now, we all start out in the womb with a tongue tie, more or less. If we follow our development here from left to right, this tongue is completely tethered as we start our development. It's a natural part of formation, and it keeps the tongue in place while it's forming. As we grow in the womb, the cord or frenum recedes. This recession is also a normal part of development. And as part of normal development, the signal driving this recession is eventually turned off. Ideally, when the frenum is fully receded is when that turns off. However, the signal can be interrupted or stopped at any time during this receding process, resulting in varying degrees of attachment as shown here. Which is why some of us can have mild to moderate tongue restrictions here and not have it go, or have it go unnoticed quite often by our physicians and dentists and the like. If we examine this connection from the inside, we can see that the connection can also be variable in terms of which types of tissue it can be made of. In example A, the tether or cord or frenum is receded completely away as it should be. In example B, the frenum is comprised only of mucosa, which is the outer layer of skin seen in the mouth. In example B, it includes the fascia and the mucosa. And in example D, the fascial connection is so strong that it pulls the genioglossus muscle up into the frenum. And when this happens, the muscle fibers themselves reorient themselves into the frenum, and the muscles themselves become part of the restriction of movement. So if we look at the neck muscle system, we can see that it is very complex. When we include the tongue in that system, and the muscles and the fascial connections of the tongue, we see that they quite often will go from the tongue to a special bone in the neck called the hyoid bone. This bone is an important anchor point for many of the muscles of the neck used for chewing and speaking and swallowing. And the hyoid bone has muscle and fascia that extend down to the scapula and shoulder blades, as well as to the cervical neck, and even up to the muscles near the TMJs. And so when there is restriction in this muscle system and the tongue itself is too restricted, we often can compensate with our other muscles to allow the tongue to function so that we can eat and speak and chew. However, it's at the expense of these floor of the mouth muscles, and we end up playing this tug-of-war game with the hyoid bone and some of these other muscle connections here, which is why people with ankyloglossia in any degree or form can have joint issues or TMJ issues, cervical neck muscle strain, and even shoulder blade tightness and strain. We couple this with what we know about the muscle of the tongue itself. For example, this is Dr. James Sim Wallace, known widely as the father of preventive dentistry. And Dr. Wallace found that an early soft diet prevents development of muscle fibers in the tongue, resulting in a weaker tongue that cannot drive primary, arch formation or the primary dentition out into spaced relationships, so it doesn't get as big as it needs to be to get fully developed dental arches. So if we couple the weak tongue with the restricted movements of ankyloglossia, we can have several dysfunctions that are happening at once. When we see this weak musculature from our softer diet, the inability for full range of motion from a tongue tie, we quite often will call on the specialties of a myofunctional therapist. Myofunctional therapy is a discipline that looks at oral muscle function and helps strengthen the muscles and balance them. Its goals and objectives are to help promote nasal breathing, strengthen and tone these muscles in the tongue and the other facial oral muscle complex, and to promote ideal resting oral posture, where the tongue sits up on the palate. And in so doing, we see an improvement often of tongue range of motion and alleviating of some of these dysfunctions that can cause pain and other problems. When this myofunctional therapy is not fully successful, we often have to surgically intervene, which helps relieve the restriction from underneath the tongue. And once the muscles have been balanced and strengthened by the myofunctional therapy, if that tether is still restrictive, surgical procedure called a tongue tie release can be very beneficial in restoring and improving the range of motion of the tongue. I've had the pleasure of training with Dr. Sarushagi at the Breathe Institute, who is a leader in the field of sleep disorder breathing and ankyloglossia specifically, and has developed a very unique and smart way of looking at this structural problem, and developed a surgical technique to alleviate that problem in the most non-invasive way possible when necessary, but still getting to the root of the problem. What we find is that if we can get our tongue functioning correctly, we will develop a nice round Roman arch with room for all our teeth, as opposed to the narrow arch that we see when it's not functioning properly. But ultimately, this helps us gain the ability to breathe through our nose with our lips sealed. We see good jaw development, which leads to good joint function of the temporomandibular joints, as well as a good open and very functional airway. And the benefits continue to move on from there. But that's just one little window into the importance of the tongue and how we address issues that arise with it. And I thank you for your time.